Hi everyone. Weight loss injection is one of the frequently asked questions in our day-to-day OPD. Is it right choice for me? Let's see the truth about it. I am Dr. Anand Patel, gastro and bariatric surgeon, sharing a few facts about it. Before I start, let me tell you about the question I came across. The first, what is the weight loss injections? What is their mechanism and what is their action in our body? What is the science behind weight loss? And can these drugs be used by individual without the obesity for just aesthetic purpose? And how effective they are compared to traditional methods like diet, exercise, and bariatric surgery? Well, the information is being sharing so much that it is widely available on internet market, and it has become some kind of easy weight loss solutions, and people are marketing that guaranteed it will work and call us. I think before we start certain medicines, we should have at least some basic knowledge about it. Well, I'm going to tell you about some fact about it. These weight loss medicines, basically they are in injection forms, and they have some kind of particular response with the hormones that tied in our body, and it produce different variety of actions like insulin secretions, somewhere in a liver decrease in the glycogen forms, as well it also works on our brain and digestive system. Let me share again. Okay, uh, let me start with the explanation how this medicine works. First, we need to understand there is a gut-brain axis. Our food intake, our food liking is directly controlled by the amount of food we consume in our body and the response it generates. This is our digestive system, and this is the shaded area is the stomach. When we are hungry, there is a hormone called ghrelin which secretes in our blood, and it stimulates our brain to increase the intake of food intake. Once this food material passes through stomach down to intestine, then there is another hormones which we called as a GLP-1 analog, which stimulates again to our brain system and decrease our food intake. So in other sense, we call them as a satiety hormone, which limit our excess eating and excess overeating behavior. This is the same hormone which is produced by genetically engineered technique, and this is the same, it is delivered in an injection form. Let's see in a detail. The food whenever passes from stomach down to small intestine, as you can see in this figure, it stimulates L cell in intestine that secretes this GLP-1 hormone. This is the same mechanism what we observed in a gastric bypass, and this is the same kind of the hormones which sensitize the insulin receptors. It secretes the insulins, so the diabetes and the weight loss comes in a control conditions. And these drugs been available in a market in a different form and the dosage. Let me tell you, these drugs are not available in India, and it is not approved for the weight loss. Here I am describing how they work. Usually it is available in injectable forms, either daily ones or weekly basis, and it produces variety of actions in different organs. Like in a tongue, it causes altered sensation. In a brain, it causes some kind of nausea and fullness. In a stomach, it slows down the gastric emptying, so leading to fullness of abdomen. Pancreas, it increases insulin secretions, so the diabetes remain in control. It inhibits the glucagon production, so glucose does not get excess production in the blood. And third is the liver, where there is a less glucose production and more in the form of fat utilizations. So this is how the mechanism all over works in our digestive system. Well, another questions is been asked, sir, what are the indications or who can take this injectable forms? Let me tell you, these medicines are available for the diabetic patients. But in the process of that treatment of diabetes, they observed that they have also weight loss. So this group of the patients we should discuss is the one who has a higher BMI, that is more than 30 BMI, with at least some kind of obesity related illness like hypertension, high cholesterol, patients who are prone for cardiovascular disease or obstructive sleep apnea, or the patient who have obesity with a osteoarthritis. So these medicines basically available for those patients who need to lose the weight. Ideally should not be prescribed for aesthetic look. Let me share you the results. Well, so many published literature is available. If you could see, this group of the drugs cannot be escalated in a shorter period of time. The dosage are increased over a period of time, as I have shown here. Along with that, lifestyle intervention such as diet and physical activity is the must. Once we start these medicines, if you want to see a significant results, at least it takes 6 to 10 months to lose around 10 to 12% of body weight loss. Once we continue around 2.5 years, then we see a significant weight loss around 16 to 18%. One thing we should be very clear, that over a period of time, the dose should be escalated to see the desired results. Also remember that 50 to 60% of them respond well, whereas 20 to 30% may have some beneficial effects, whereas 10 to 20% of people may not respond at all. The duration of the treatment is lifelong, at least for 6 months. Another question is commonly asked, sir, what will be the side effect? Well, this is a hormone-based therapy, and there are certain common side effects like nausea, vomiting, constipation and diarrhea because it acts on our GI system. And there are undesired side effects that is very uncommon but can be complicated like acute pancreatitis, acute gallbladder disease and gallstones problems. One should remember this is hormone therapy. A family history of thyroid cancer should avoid. Also, I would like to emphasize, because these medicines are recently available, we don't have a long-term data beyond 5 to 10 years. Well, this slide I have designed to make you understand how effectively we should manage our resources. Suppose we are targeting 5 to 10% of body weight loss, suppose 5 to 10 kg if we are assuming that you are 100 kg weight. Then the diet and physical activity is enough to achieve that desired effect. But if you have a diabetes, blood pressures, then definitely you need more than 10% to achieve a good control of your illness. For that reason, you need a medications. Well, the cost of medication is around 12 to 15,000 per month. Along with that, you have to add some diet, nutritionist help, as well as the fitness. But if you are targeting more weight loss beyond 25%, and if you have lot of obesity related health issue, for that reason you should take a bariatric endoscopy or laparoscopy. Consider this is the standard of care for those group of the patient who need to lose more weight. For that reason, you need to know where to utilize your resources. Well, given the possibilities of different aspect of obesity treatment, I want to highlight, first we should target our weight loss. If you are targeting for 5 to 15 kg, the best combination is a diet, exercise and medicines. But some person is BMI more than 40 or more than 35 and they need to lose at least 15 to 20 kg. For them, the balloon and the endoscopic intervention might be helpful. But do remember, here you require patient fitness and strong follow-up for the good results. But when you are targeting more than 25 kgs of weight loss, as well as correction or remission of obesity related health issues such as severe hypertension, diabetes, and severe obesity. For that, you need to go for the laparoscopic bariatric surgery. Hope you like this information, and if you have a questions, you can contact to our center. Thank you.